Good evening, everybody.
Good evening, Byron.
How you doing, Frida?
I'm doing all right. It's good to be here.
All right, welcome everybody. It's 6 o'clock, but we're gonna give it just a couple of minutes here before we officially get started. Thanks for your patience.
Welcome, everyone. Yeah.
Recording in progress.
All right, good evening, everyone. We're gonna call this meeting to order now. It's 6:03 p.m. on January 31st, 2024, and this is a public meeting of the Portland Committee on Community Engaged Policing. My name is Dory Grubinski. I'm the PCCEP project manager. And tonight we are joined by a facilitator named Afrida, who's going to help guide us through our meeting agenda. And I'm going to hand it over to her at this time.
All right. Hello, good evening, everyone. Thank you for taking the time for to being here tonight. As Dory said, my name is Afrida, and I will be I'll be the facilitator for this event. Next slide, please. Wonderful. Please be aware that interpretation for this event is available in Spanish and American Sign Language. Thank you. This town hall is a public meeting, so the video recording and chat transcript of this event will become part of public record. We ask that you use the chat function in a manner that is respectful of the people who worked hard on this event, the city officials that are joining us, and community members asking questions. If there are repeated violations of our community standards, which we'll review in a moment in the chat, we may not be able to leave the chat open. And like I said, we'd like to take a minute to review the community standards for this event, please. Be respectful of our attendees, panelists, and staff in your word choice and avoid harmful comments. This includes comments that are considered likely to disrupt, provoke, or attack others. Racist, sexist, homophobic, sexually explicit, abusive, or otherwise harmful. Hate speech, harassment, or doxing in any form. Please respect PCEP staff and their responsibility to uphold these guidelines. And lastly, attendants who violate these standards may be removed. Thank you. And now let's hear some introductions from our PCEP members. Any city, DOJ, or PPB members, please feel free to use the chat to introduce yourselves. Tia, since you were the first on the call today, would you like to get us started?
Okay, sure. My name is Tia Palafox. My pronouns are she, her. I am the co-chair of the Community Engagement Subcommittee. I've been a member of PCEP since 2021. Thank you.
Excellent. Tia, would you like to choose the next person?
I'll pass it on to Ashley. See below me here.
Thanks, Tia. Yep. Ashley Schofield. I like to use she, her pronouns. I was the co-chair of the community engagement subcommittee with Tia. I believe this is my last sort of meeting in that capacity. And I was recently elected co-chair of the full committee. So welcome, everyone. I'm glad everyone's here tonight. Odelia, do you want to introduce yourself?
Yes. Hi, everyone. I'm Odelia Zuckerman. I use she, her pronouns, and I just took Ashley's spot as the other co-chair of the community engagement subcommittee. I will pass it to Carrie.
Hi, my name's Carrie Driver. I use she, her pronouns, and I am a PCEP member. I'm trying to see who's still on. I think Kip.
Yeah, hi there. I'm almost to my desk, so sorry I'm not on video. My name's Kip Silverman. I use he, him pronouns. Newly elected co-chair of the Settlement and Policy Committee. And I can't readily see who else is here, but I heard Byron's voice, so Byron.
Byron, are you available to introduce yourself? Okay. Doesn't seem like Byron's available to introduce himself at the moment. Yeah, is there any other PCEP members on the call? I believe that might be it. All right. I will pass this off to Tia.
Would you like me to introduce the invited guest?
Yes.
Okay. We have speakers tonight, Casey Jones and Stephanie Sullivan. And Casey Jones, would you like to provide us your presentation at this point?
Sure. My name is Casey Jones. I use he, him pronouns. I'm the Audit Services Director in the City Auditor's Office. Do you want me to just jump in, share slides, do all that fun stuff?
I think Tia meant introduction. We'll get to your presentation.
Sounds great.
Yeah.
I'm
Okay.
sorry,
Then,
I don't have a script.
Sure. And then I didn't see Stephanie here, but I do see Chief Gillespie, so he might be ready to go after me.
Yeah,
Yes.
I should add anyone else who might be relevant to the Q&A. Feel free to chime in at this point as well and introduce yourselves and go away, Chief Gillespie. Thank you so much.
Yeah, thank you, Casey. Yes, so unfortunately, Stephanie is not able to make it tonight. She sends her apologies, but you get me instead. So I'm really happy to be here. I got to meet with this group. I think it was back in the summertime. So I look forward to the conversation and the questions. Nice to see y'all.
Happy to have you. Thanks for being here.
Of course.
Okay, so now just for a quick overview of today's meeting, we're going to talk a little bit about PCCEP's framing to start us off, and then we'll go into the presentation of the auditor's report, and then we'll have a Q&A on that report. And then lastly, we'll have open public comment. And so we won't take questions during the presentation, but we will after during Q&A. So just keep those in mind and write them down as you have them. Thank you.
All right. Next slide. Thank you. So, and now we'll have some framing of the comments from the PCCEP full chair, the full committee chair, Ashley.
Sure, thanks, Sabrina. Yeah, just a little framing of why PCCEP has brought this topic to our forum. As you may or may know, PCCEP is a group of 13 community members that are appointed by the mayor and who act independent of the city and the police. Our work includes assessing the progress of the DOJ settlement agreement that the city has. And part of that is gathering input from community on PPB policies and practices. So there's a lot of wonderful advisory groups out there that sort of do the same thing, but not necessarily tied to the settlement. But one thing that PCCEP has as part of being under the settlement is that when we make any recommendations to the mayor and the chief, there is this mandate for a response in 60 days. So that's something that we can hold. We can, keep the community input as a city accountable to the community input. And so, yeah, thinking about timing and why we're here today. So part of the work that we do for the settlement, or part of the settlement, excuse me, I should say, is to ensure that encounters between police and persons with perceived or actual mental illnesses or experiencing mental illness crisis do not result in necessary excessive force. And so, PCCEP has always had this investment in supporting alternative response systems as part of the settlement agreement to mitigate those opportunities of excessive force against those suffering from mental health crisis or our most vulnerable members in our community. And so this topic is something we've been wanting to bring back as Chief Gillespie had mentioned. We had invited Commissioner Renee Gonzalez, who is the commissioner that oversees the Fire and Rescue Services Bureau, and the mayor's office last summer, back in August of 2023, to just talk about the updates of the Portland Street Response, which is a very well-known, community-driven and supported program, alternative response program for those experiencing mental health crisis and need a little more experience. So so today, and what PCCEP's arm or what PCCEP's influence here is to create forums and create space and access for community input and information sharing around areas of police policies and programs. So today, we're excited to again, create another forum for questions. We've invited, as we've already said, we've invited the auditor to review their most recent report about these alternative response programs that are currently under the Fire and Response and Services Bureau. And so we look forward to just exchanging more information and addressing questions and just making sure we're kind of all linked in on what's going on with the program that is very much community supported. So I will stop talking so we can get down to the meat of the program, and I'll pass it over to Frida. Thank you.
Thank you. Before we jump right into the presentation, I just want to ask, do we have Spanish support, translation support that is on the call?
Yes, but I'm not assigned as the interpreter.
Yeah, we're getting that sorted out right now.
Thanks.
Okay, excellent. All right. So I believe at this point, we're just going to go ahead and turn it over to you, Casey.
Sounds great. All right. I am gonna make sure I'm sharing the right screen. Okay. Thank you for bothering to find our new logo and put it in there. It's very important to us. So, like I said, my name is Casey Jones. I'm the Audit Services Director in the City Auditor's Office. I've been in that position about 2 years. Prior to that, I was in the Independent Police Review when it was in the Auditor's Office. So I'm very familiar with PCCEP and the settlement agreement. So happy to join you today. Thank you for your interest in our work. So the city auditor is independently elected and does not report to city council. So as you may know, right now, the city is structured in a commission form of government. So there's 5 council members, the mayor and city commissioners. They fulfill both executive and legislative functions. And the city auditor is independently elected according to charter. We have access to any records we need to do our work, and we can audit any city bureau or function. We select topics to audit and announce them at the beginning of each fiscal year. So that's at the late June, early July time period. The current city auditor is Simone Reddy. She started her first term in January of 2023. In my division, we perform performance audits. So we do that according to these government auditing standards. We call it the yellow book for obvious reasons. It is yellow. So those performance audits review efficiency, effectiveness, and equity of city programs and services. We can, like I said, cover any program or service in any city bureau or at Prosper Portland, the development arm of the city. So we consider performance audits an evaluation of evidence and kind of the current state of things against established criteria. These audits provide an objective analysis to help management and commissioners improve program performance, reduce costs, initiate corrective action, and contribute to public accountability. So our role is to kind of do a deep dive on something, examine it, and then make recommendations to management for how things can be improved. Every audit has 4 phases: planning, fieldwork, reporting, and follow-up. For this audit, it started as a kind of generally widely scoped audit about fire bureau workload. As we started, we became aware of kind of several other studies underway. I linked to those in the chat. The Fire Bureau had contracted for a study through Citygate Associates, and they presented their report to council early on in our work. And then PSR specifically was being studied by PSU. I'm sure you're kind of all aware of those reports. So for us, we do kind of try not to do the same thing that somebody else is doing or kind of be redundant or repetitive, but we do try to find a place where we can add value. We did kind of see a situation that the Fire Bureau was in where medical calls were rising, or medical calls made up a big chunk of the call volume, and non-emergency calls were rising. So the Fire Bureau did have these 3 divisions, or one division, the Community Health Division, with these 3 functions: the Portland Street Response, Community Health Assess and Treat, or CHAT, and Community Connect. During our field work, I should note that our field work ended in May of 2023. So I'm glad the chief is here to kind of give an update on things that have changed since then. So as you may be aware, Portland Street Response is a function where a community health responder and mental health crisis responder go out to low acuity mental or behavioral health crisis calls or substance abuse related calls. For CHAT, 2 community health medical responders go to a low acuity medical call. I know there is a newer maybe subset chat team that maybe the chief can speak to that's downtown and focused on overdoses. And then Community Connect is the final small piece here. and they offered a combination of programs focusing on high utilizers of 911. So these would maybe provide mobile vaccinations, education resources, and maybe some aftercare support for folks who had engaged with either of the other teams, so Portland Street Response or Chat. And the Fire Bureau let us know that those services, when these two functions were moved late last year into the Medical Services and Training Division, that the Community Connect services were kind of absorbed by other folks in the division. So we seeing these community health functions, this kind of being a new area for the Fire Bureau, we approached this as a readiness audit. So we kind of tried to, doing an audit of something early on can help assess the organization's preparedness to fully implement important programs so that they can make course corrections and kind of set things up for success. So we decided that our audit objective would be whether the Fire Bureau is strategically building the Community Health Division to shift workload from fire crews. And we conducted our fieldwork interviews, reviewing documentation. Since this was kind of focused on Fire Bureau management, that is kind of interviews with higher level folks. We did a Portland Street Response ride along and talked to folks within different parts of the Community Health Division. Then this is kind of just an explanation of how we present our work, and this comes from that Yellow Book standards earlier on. So when we are putting together our work, it has to fit into the elements of a finding. So the criteria is the way things should be based on guiding principles, laws, regulations, strategic documents. So in this case, we used best practices from an association of kind of Fire Bureau best practices and some general criteria for how to set goals and how to measure performance and those sorts of things. The condition is the way things are. So this is a lot of stuff that we find through interviews and reviews of documentation. The cause is something we have to dig a little bit for. Again, coming from interviews and sometimes looking at which pieces of the criteria maybe aren't there. So we try to figure out what's behind the condition, focus on what's maybe most controllable by the Fire Bureau in this case. So then we have to have an effect. So what can happen if this is not corrected? This is also known as a risk. And then we make recommendations for how best to address both the condition and the cause to lessen that negative effect. So our first finding was that the Fire Bureau did not establish clear goals for the Community Health Division as a whole, and that more specifically, goals existed for each of the programs, but that Fire had not established a clear goal for the division overall. So you think about kind of each division is kind of going out and addressing a problem. Then how do you measure success when you roll those divisions together, and what are they solving together? And then our second finding is that the Community Health Division had an uneven approach to measuring, or the Fire Bureau had an uneven approach to measuring Community Health Division performance. Sorry about that typo. And then this chart is from our report, and it kind of illustrates what we're talking about there, where we're showing, the Bureau had some goals. This, I think the left is Portland Street Response and the right is Chat. Sorry, it's blocked by the Zoom menu for me. But they have goals related to similar things, but they're not being measured in the same way. So this kind of goes back to my earlier point about, are you measuring success in the same way to be able to roll it up into overall success in either addressing low acuity calls, response time, those sorts of things. And kind of a sub aspect of that is then the Bureau did not also not have a process for adjusting performance measures if they were not useful, or for making programmatic adjustments. So these would be, hey, we're addressing more of this type of problem, so maybe our performance measure should be more about that. Or we are really not focused on this issue anymore, or the city has this more urgent need, and we're kind of in the best spot to provide that. Then this kind of gets into cause a little bit. So we found that the Bureau's inconsistent commitment to the community health programs during our field work magnified shortcomings and contributed to an uncertain future. So I think most importantly for us, most of our findings focused on having clear goals and plans and assessments and measuring your performance and adjusting when things are successful and you could do more, or maybe learning when you're ready to level something up or expand something. So those are all things that are especially important for new programs. So like I said, this was a readiness audit. We're kind of taking a pulse of where these new programs were, and then trying to make sure they were set up for success. So for us, those were kind of the most important things that we saw missing. And some of the various causes that we got at through interviews and observing the Bureau during field work. So the Bureau has consistently eliminated administrative and support staff to protect emergency operations from budget cuts. So that leaves them with fewer resources to devote to planning and data analysis for the Bureau as a whole. And then Bureau managers and staff told us that the Bureau is not inclined to devote resources to these community health programs if those resources would come at the expense of more established programs. There were various changes and disruptions after that. There was a hiring freeze. There's a new dispatch system that kind of makes parsing calls a little more difficult. There was political changeover. So this program was PSR specifically established and championed by Commissioner Hardesty. And then there was a change in commissioner and a change in guidance that folks had to adjust to in the Bureau. And then Portland State and some of their research have noted cultural differences between firefighters and street response employees. And then there was a disruption in leadership at kind of the mid-level management level, and the programs, like I said, have since moved under Deputy Chief Sullivan. So at the end, we have recommendations. I think this first one is kind of our most important one. Really clarify what these community health programs are intended to do, and find a place for them is a short way of saying what we have. And then the rest of the recommendations stem off our findings around goals and measuring performance. So we like clear goals for the programs of the former community health division, and then create a plan for those divisions to achieve those goals, and then measure the progress of those programs toward meeting those goals. If one of those goals is to reduce emergency operations fire crew workloads, the Bureau should measure how much the programs taken as a whole do so, and then adjust the programs based on whether or not the goals are being met, and develop a process to review performance measures on an ongoing basis. And then here's my email, and you can read more of our work at portlandoregon.gov/audit-services.
All right. Casey, that's the conclusion of your report.
That's it.
All right, wonderful. Thank you very much. Really appreciate you taking the time and putting this all together for us. Now, could we get the slide deck back up?
Yeah, real quick, Frida, I was thinking, since we're joined by Chief Gillespie, I'd like to invite him to also, make any opening comments or an introduction if he would like at this time before we move to Q&A. If that's okay with you, Chief Gillespie.
Yeah, that'd be great. Thanks, Dory. Okay, my name is Ryan Gillespie. I'm the fire chief for Portland Fire and Rescue. Casey, I want to thank you and your team for performing this audit for us. We have worked with the auditor's office in the past. We somewhat recently had an audit on our accountability and complaint system. Just a ton of great recommendations came out of that, and we've been able to implement a large number of those. So these audits that Casey and his team does throughout the city are really valuable. Speaking for myself and as a bureau director, extremely valuable to be able to look at recommendations from an outside lens and look at how we can address some of those issues that, again, like Casey said, may not be going against best practices. And so we can improve our programs. So this one in particular, I did write a letter in response, and that's included as part of the report. I don't want to, I wasn't planning on going through and repeating everything. I'm happy to answer questions about that. I think the biggest challenge with this report for us, and again, I completely agree with most of the recommendations. That the challenge was the focus of the audit report, in that the programs that was not their goals originally. And as things morph, I will say, and it was also a point in time. So as Casey said, their pens went down in May. Since May, there's been a number of changes, and I actually have a graphic I can share later that Deputy Chief Sullivan's worked on with her team of kind of the year in review of 2023 for community health. So that was the challenge with the report, is that we felt like we had made some really positive changes and was heading in the right direction with our community health programs, while at the same time understanding that we're not able to change everything, right? Things take time, and that's where the auditor's report can really help us. I'll also say, for those of you that haven't seen it, Deputy Chief Sullivan did an interview with Ken Boddy on Ion Northwest Politics on Coin. I think she did a great job. She's an incredible person. She's an incredible leader of these programs right now. He asked her some tough questions, and she answered. She was great. So if you haven't seen that, I would encourage you to take a look. And that, of course, I'm more than happy to answer questions tonight, but I think that could help. That could help answer some of the questions as well. And yeah, again, I can answer. I'm happy to hear questions or concerns. I will, and my stance on this has not changed since we met in July, in that myself and Portland Fire and Rescue, we strongly support these programs. There's some very challenging issues to work through. There's growing pains. I support these programs, and I will tell you, since the audit report was finalized, the changes that have been significant, in a positive way, and heading us in a positive direction. So I'll stop there, and I'm happy to have a conversation.
Yeah, thank you, Chief Gillespie, for just adding your voice to the space and being here for this conversation. Just a note for folks who are online with us, Casey, thank you, Casey, dropped the Chief's response in the chat. And then Ashley, thank you, Ashley, dropped that interview in the chat as well for folks to view. All right, so now can you get the slides? And so now we're going to move into the Q&A portion of our time together this evening. And as we stated, our invited guests are here to chat about or respond to the questions from PCCEP members and community. So we will begin with questions from our PCCEP members first, and then transition to open Q&A from the public. The focus of tonight's meeting is to learn from our invited guests. Please keep that in mind when formulating your questions. PCCEP may host events in the future that are oriented towards community testimony. Please enter the queue by raising your hand on Zoom, as Ashley has there, and wait for the facilitator to call on you, or wait for me to call on you. Please limit individual questions to 2 minutes. Those using interpretation will be allotted 4 minutes. We may not have time to hear from everyone tonight, but PCCEP wants to hear from your input and will consider it in our ongoing work. Please send written comments to our public comments forum. You can send an email to the pcecinfo@portlandoregon.gov, and all contact information is also found on the PCCEP website on portland.gov as well. All right, now we're going to open into the Q&A, and like I said, please raise your hand, including PCCEP members for this first part. If you have a question that you'd like to enter the space, please raise your hand as well. Ashley.
Thanks, Rita. So yeah, I guess I wanted to dig in a little bit more to this sort of disconnect with the purpose of the audit. Casey, you talked, you presented sort of like the steps that were made to get there, and like you mentioned, the Citygate audit and the PSU report, and so there were these conversations sort of going on about the success and the will to push these programs forward. And my understanding was it was always under this, like, to alleviate workload that we hear all the time from all the first response entities, right, in the city. So I'm just curious your take, Casey, and then I'd love to hear from Chief Gillespie about just where that disconnect has happened. It's been kind of stated here, it's been stated here tonight, and also sort of the media. Curious what your interpretation of that is.
Yeah, so for us, some of the benefits to fire specifically were highlighted in that Citygate report. So they talked about sending a whole truck to somebody's medical call or a low acuity call may not be the best use of resources. And then kind of doing that over and over again, has an impact on morale, those folks' availability to report to emergency calls and those sorts of things. So I think the chief outlined in his response that the program was not set up to do that. And it does tend to take more call volume away from police. I think for us, as we were finishing our work and so many things were changing, and there was discussion about where street response could go, where any of these programs should or could live, including, hey, should it be in community safety? Hey, should it be at the county? A lot of ideas kind of got thrown out there. So we did try to shift the overall message of our report to medical calls and low acuity calls are big issues that maybe none of our existing response systems are set up to deal with kind of at the volume as they happen. So hopefully these recommendations would be of value to whoever and wherever this ends up. And then I'll let the chief speak a little more to the history of the purpose of the program and that sort of thing.
Yeah, thanks, Casey. So managing workload and call volume in the fire department is a constant and never-ending effort. Our calls for service have grown rapidly, and we take different measures to try to manage that. One of them is sending a more appropriate responder to a call, or not responding at all in some cases when it's non-emergent. So looking at the community health programs, we do need to separate them here. So Portland Street Response, as it was designed, and its goals, which they are still there, is to send a more appropriate responder to mental and behavioral crisis calls. Those are not, less than 2% of those were once fire calls. So the impact to our call volume and our workload in the Fire Bureau from Portland Street Response is minimal. It absolutely has an impact to police call volume, and it absolutely is Portland Street Response is a more appropriate responder for these types of calls. But the impact to our call volume is minimal at best. The chat program was designed and is designed to respond to lower acuity calls, which again, we've managed these in the Fire Bureau for years, for decades. What we noticed was the services that the folks need that had these low acuity medical call problems that were calling 911, we weren't able to serve them appropriately in the fire department. So what they needed was access to medical care. They needed somebody to take some more time with them and help them with that access, education on some parts. And so while they were responding to low acuity calls that we would be doing otherwise, the goal was not to reduce our call volume through chat. It was, again, to send a more appropriate responder. And really the uniqueness of chat was the way it was funded. It's not funded through the general fund. It's funded through Care Oregon and a grant where they have an interest in keeping people out of the medical system. So we wanted to keep folks from entering the medical system, entering the emergency department that was overloaded, if we could do that. As rapidly as things change, I will say, since the report came out, there is a program within chat where one of its goals is to reduce fire emergency operations response, and that's the opioid overdose response unit. So that is operated by chat and out of Station 1, and they are responding to overdose calls down in the central city. And one of the goals of that program is absolutely to reduce call volume and workload on our emergency operations crews. But again, this was after the audit. This was after even I sent my response. So during the time that we're talking about, that was not a primary goal of either of the programs, although it was a benefit of the chat program.
Thank you.
And I know folks are putting stuff in the chat. I'm not very good at bouncing back and forth and checking if there's something specifically for me. So just let me know if there's something I should read in there, if there's something to address.
Yeah,
Yes.
I'm gonna encourage our community attendees in the chat to definitely ask those questions during the community portion, which we'll get to shortly here. And yeah, no pressure on our presenters to keep track of that. We'll try to flag this for you if something is in there that is of note. Thanks.
All right, Byron.
Thank you, Frida. Can you hear me good?
Yes.
Chief Gillespie and Casey, I want to commend you on the work that you've done for holding down this situation when something was thrown into your hands and you had to adapt, you had to adjust, you had to bring in people left, and you still was able to maintain the situation. With all you said, I am sold on this whole situation. Now, my question is who's better equipped to take over the situation? You had alluded to it a little bit, Casey, the city or the county, who has more of I guess, this is what we do, this is why we are here, in a sense, instead of picking the city or the county. To me, I feel like the county may be more equipped to handle something like this, if that makes sense. Also want to thank Stephanie Sullivan. That was a beautiful interview that she done. It was very informal. There were some things I didn't know, I did learn. So with that being said, Frida, yeah, so that would be kind of my question to Casey and Chief Gillespie. And then going forward with that, and then when you're talking about the Portland Street response, are you speaking also we cover Fairview, or are we also covering 223rd and Burnside? Are we covering Milwaukee? What would be the demographics of Portland Street response if we're going to keep this going? Because we all know we need this. What's that? Friends of Portland Street response is helping them, got some things going for them. So that would be my question. And sorry for rambling if I did.
I'll jump in there on that one first. Casey, if you're okay with that.
Yep.
Byron, thank you for the question. First of all, as far as the response area, it is a City of Portland response at this point. So we respond within the boundaries of the City of Portland. I think the question about where does the program belong, who is best suited to manage it or to run it, that's an excellent question. And I wish I had an answer for you. You know, my response, and Stephanie actually answered it the same way in her interview, is that while it is assigned to the Fire Bureau, we are going to do our darndest and our best job to support the program, to build the program, and make sure that the services that the community has asked for, that we provide those. Long term, where it goes, where it lands, excellent question. I think that absolutely needs to be addressed. In the short term, one of our big challenges is the funding. And I think I spoke to this last time I was here as well. The funding for both of our community health programs, for the most part, is one-time funding. And so in order to maintain the programs, to build the programs, we need to be supported by adequate financial resources. The city as a whole is extremely stressed. The general fund, especially for resources, and we're going into budget season right now, where we'll be presenting to City Council, and they're going to have to make some difficult decisions about allocations of really limited resources. That's where I think one of the upsides of these innovative community health programs is that there is opportunity out there for alternative funding. And we're working on pursuing that, and that has to continue to keep the programs going. So long answer there, Byron.
No.
I hope that addressed most of it.
Yeah, it's my thinking. I didn't mean to cut in, Casey. I still want to hear your perspective. I just was thinking, because if it's on the county side, and I on that side of Multnomah County, I would love to spearhead some type of project on making sure this is implemented well and it can carry on, because until this is not something that's expanded, I don't know, I think we should be reaching a little further, a little wider, and helping everybody else instead of just, and it's my fault. Go ahead, Casey.
Oh no, I think there is a lot we learned during our initial planning stages about overlap between Fire Bureau responsibilities and some of the county responsibilities in terms of community health, in terms of ambulance response that I know the chief has addressed recently. There are a lot of situations that could benefit from a city county discussion about what are the types of calls that we're getting that we don't know how to address, or we don't know who should go, and then figure out from there who should be doing what. So that's where our first recommendation here, to clarify to Bureau employees, the public, and City Council, to what extent the Bureau is committed to operating the programs, and if the Fire Bureau doesn't intend to keep the programs, work with City Council to find the appropriate home for them if council agrees they provide an important service to Portlanders. So I think starting with the what do we need for Portland, and then who should do it, is maybe the right way to start that conversation.
Casey, I mean, if it's just if the holdup is just finances, funding, and how we're gonna do all this, and I'm not trying to be funny, but I mean, let's flip a coin and see who takes what, and then we can move forward. Because you got all the support, you got everybody behind you. Who's gonna do what? Let's make up a decision. And I'm just thinking in my mind, and so it can be moved forward, because it's well valued and it's well needed in the community.
Thank you, Byron. Kip?
Let me find my unmute. Yeah. First of all, Chief Gillespie and Casey, appreciate you being here. Appreciate all the turnout we got. I'm looking forward to some of the community conversation. One thing I'd like to understand better overall is I've heard from over the last several months, including the previous time PCCEP took up Portland Street response and in various interviews and even the interview with Deputy Chief Sullivan. Sorry, I keep losing my voice. I'll try to keep it going. That there's a challenge in understanding, and please correct me if I'm wrong here, of or that there still needs to be the ability to figure out how effective Portland Street response is and whether it's being as effective as it should be, and the model to move to 24/7 and the funding and all these moving pieces. What I've kind of missed from all that conversation is what's the framework to understand if it continues being successful. We know that the initial reports, I think from PSU, found it extremely successful. I think I read last year it responded to, or maybe it's, I'm not sure which calendar year, over 16,000 calls that would have been handled by police or fire or otherwise. And it's immensely popular with the community, and we know that their focus is to address people in low acuity crisis, whether it's mental health or drugs or something else. So with the amount of community we have showing up here, it's clear that they're doing good, and they're needed and wanted. What I really want to understand is what's the framework to keep validating this work as we go along and proving the argument that if it needs more funding, how do we find it? Understanding that resources are slim, but with the multiple crises we have across our city right now, we need focus too, and we need to address some of the people who are in the most critical need of services. So that's a long, you'll find Byron and I ask very long questions. I apologize. But my basic question is, what are the metrics that are needed to keep moving this forward and fill in all the other missing pieces to go 24/7, to expand the shifts, to embed people so that they can actually go into buildings and all these other interconnected pieces. And I'll stop talking, so whoever would like to answer, feel free, please.
Sure. Thanks, Kip. Yeah, I know I probably sound like a broken record, and I apologize, but the finance and the funding is really what it comes down to. And for any program, especially a new program, you have to provide the support pieces behind it to build that foundation and then have a sustainable a program that does the work that the community is asking for. Again, it seems like a simple answer, but it gets very complicated when you also mix in the responsibilities for this. And this was alluded to before. There's a need throughout the region. There's a need throughout the county. Should Portland Street Response be run by the county? Should the county be paying for it? Should the city be paying for it? The plane has not been landed on that one of really the overall responsibility for it. We as first responders in the city of Portland see the benefits to the community, and absolutely on the police side, the mental and behavioral health calls that they were going to in the past, that Portland Street Response is able to respond on now, a far more appropriate responder. We have to have the funding to be able to do it. But again, it's as important as this Portland Street Response program is. There are dozens of programs throughout the city that are funded through general fund tax dollars that are also critically important. And so I think that's the real challenge that our elected officials have to tackle, is how do we allocate this, again, limited amount of money to all these programs that are critically important. I guess the upside of the challenge that we're in with the funding is, I think there are other opportunities out there, right? Whether that is the county or healthcare providers or federal dollars or state dollars, those opportunities are there. We need to keep working to make those happen. And Casey alluded to it before. What we've had to do in the Fire Bureau over many, many years is cut our support system behind us. So to maintain our first response system, to maintain the fire engines and the fire trucks going down the road, we've had to cut a lot of support behind that. And that's logistics, that's finance and accounting. And one section that we don't have at all in the Fire Bureau is a planning section. So a planning section that would do the work to what is not just Portland Street Response, what is community health? What is emergency operations? What is emergency medical services? What does that look like in 6 months? What does that look like in a year? What does that look like in 2 years? How do we work towards that? I wish we had the resources to be able to dedicate towards that and really build out a clear plan and a pathway to get there. Part of that, of course, is the funding piece and weaving all that together. So yep, I apologize. That was a long answer as well.
No, I appreciate it. I feel I understand the funding being critical. I also feel like the people who are facing the challenges most amongst us need to be the priority, one of the many priorities. I just learned something. The lack of having planning funding and planners, that seems to me to be a huge risk to our city, period. To be able to understand what the next 6 months, 12 months looks like. And maybe that addresses part of my question as well, is what are the metrics to prove that Portland Street Response or this program or that program need to be elevated based on what we need coming down the road. And I think that I learned something. So thank you.
Yeah, and I think just quickly, I think this is going to be one of the benefits of the new structure, the reorganization within the city, and having service areas, having deputy city administrators being able to collaborate better with the other bureaus. So we have a Bureau of Planning and Sustainability. The city has one. We work with them on kind of individual projects, but for fire department specific things, we're kind of on our own for that, where I see a future state here pretty soon where we're going to have much better cross collaboration with those other bureaus, and where we may not have planning resources, other bureaus may, and we can tap into those a little better than
I share your hope for that future. So thank you.
So now at this time, we're going to go ahead and open this Q&A portion to our community members. Just a reminder, if you placed a question in the chat, we really encourage you to raise your hand, and then when called on, come off mute to ask your questions. So we'll go ahead and take a question from Tia, but community members, please go ahead and raise your hand. We'd love to hear your questions in the space.
I was thinking back on a graph that was published in the audit where it had the medical service and training division. And then next to it was the emergency operations division. I was wondering if those two divisions collaborate together and I remember it said Commission, Chief, Medical Service and Training Division, Emergency Operations Division, and the Portland Street Response. And the chat program was underneath the Medical Service and Training Division. I was confused I thought it was under Emergency Operations Division. And are they collaborating together? And would that be helpful if there was more collaboration between those two divisions? And then
Yeah, sure. Oh, sorry. Do you want me to explain that one quickly?
Sure. And then I would that, yes.
Okay. Sorry to interrupt you. So the way that the Fire Bureau is broken up, essentially, currently, we have 4 divisions. So we have emergency operations. That would be the fire stations, the firefighters, the fire engines. We have 171 firefighters on duty a day, 24/7, 365. That's emergency operations. We have our fire marshal's office, which is a separate division. So that's fire prevention, code enforcement, fire investigations. We then have medical services and training. So that encompasses our recruit training, incumbent training, the emergency medical services that we do, which is a big percentage of the calls that we go on. We have certifications that we have to maintain. We have logistical needs. And so there is a ton of cross work between medical services and training and emergency operations. And then we also have, basically our services division, business services, was a separate one, and that's in flux right now with the city reorganization. When this audit was done, we had a community health division, right? And within that was Portland Street Response, Chat, and Community Connect. When I took over as the interim chief in July, with the goal of having better cross-division pollination and collaboration, I incorporated the community health programs into medical services and training. So that was one. And I talked to Casey about this, and I kind of pushed back on him the way that the report was written, that was knocking community health programs kind of down the ladder a little bit, moving them under a different rank of a supervisor. That was absolutely not the intent at all. The intent was to better incorporate them into the Fire Bureau and really remove some of the silos that had been there and had been identified operationally and culturally. So that's how we're broken down, and it's I'm very pleased with how that's working out so far. The being able to work within the medical services and training division has done nothing but help build the programs.
Oh, so you do collaborate with each other. And
absolutely. Yes, absolutely.
The question I had was with PSR and Chat, do they collaborate, but they can't merge because they have different funding sources?
That's a great question. Well, their missions are somewhat different, right?
Yeah.
The types of calls that they go on are different. So they absolutely collaborate in that the programs report to Stephanie Sullivan, so they're under that same umbrella. They operate out of the same building. Sometimes the supervisors will cross over and assist where needed. A lot of the work that we've been doing to build out field training programs, to build out basic employment policies and training we've been able to do that for both PSR and Chat because of the similarities, and then there's also differences which we can address through training. So the funding sources are different, absolutely, but because of limited resources, we do our best to get the most bang for our buck, really. And so that's the more collaboration we can do between the divisions, between the programs, I think the better use of the limited dollars that we have.
Okay, that makes sense. Thank you.
Sure.
All right. Now we're moving to community questions. Just a reminder to limit your questions to 2 minutes. And if you're needing interpretation, there's 4 minutes that's allotted. Kayla.
Hi, I had a question about if PSR is going to be expanded to 24/7, and if they're going to be expanded to 24/7, is there any consideration to assign units to neighborhoods with high wait times or high call? And my last question is, as PSR expands, will there be a creation of any advisory committees or councils?
Excellent question again. The goal is to expand PSR. And again, it's when I spoke with the group in July, I kind of went through why that expansion that was being called for by the community and requested by the community, why that wasn't happening as rapidly as everybody wanted. Those circumstances haven't changed significantly, but we've made leaps and bounds on especially on the policy side and the foundation for the program to set it up, Portland Street Response especially, to set it up for an expansion at some point. I don't know when that's going to happen. And again, it really, funding is such a big part of it. There is still a lot of work to be done on the policy and the training piece, but we're heading in the right direction. So it's I can't give a timeline on when that might be, although I completely understand that the community's asking for it. And I'm sorry, there was a second part to the question. I think it was about where we would place units. We do try to deploy them in areas that, because they start from the same place every morning, and then they will spread out throughout the city throughout the day. So they're not always coming back to the same location in between calls. They will be out and about in the city. And the way we're dispatched, and this is really public safety as a whole, the closest unit for the most part, most appropriate unit will respond to that call for service.
Great. Stephen. You're on mute right now, Stephen.
You think I'd learn that by now. Thanks. Chief Gillespie, nice to have you here and appreciate your engagement. I am involved with the Friends of Portland Street Responses. I'm sure you know, last July we launched a petition in support of Portland Street Response, and within a week, 10,000 folks here in Portland signed on, ultimately about 12,000, and there were 5 asks. And the first and probably most important one was the expansion of PSR to 24/7, which requires fully funding it. As you noted, there are challenges throughout the city in terms of funding, and in particular with PSR and chat. As you noted, there are one-time funds supporting them this year. So interestingly, within a month of the petition being released, actually Commissioner Gonzalez in a TV interview said he supported PSR going to 24/7. So the question is, the budget process for the next year is coming up. It'll start in April. And what can we expect in terms of support for PSR going to 24/7, as Commissioner Gonzalez spoke to late summer?
Sure, and I wish I could tell you. I wish I could tell you what the budget would look like for the Fire Bureau and public safety as a whole come July 1. The short answer is I don't know. Again, there's the city as a whole has, as the complete city, has a number of gaps that need to be filled. There's a large one-time funding cliff across the city because of the one-time funds that are expiring. ARPA was a big part of that, which funds is one of the funding sources for Portland Street Response currently. So Stephen, I don't know. I think there's going to have to be some challenging decisions made around public safety as a whole, and within that falls all the programs, Portland Street Response, and chat, our community health, our emergency operations. Really difficult decisions are going to be coming up on where that money is going to be allocated. So I think we can, and I feel comfortable saying I have a goal. My goal is to expand the program. My goal would be to have Portland Street Response running 24/7, but we need to have the funding to do it. We need to have the foundation in place to do it. I think I can say both, because I feel both ways. I want it to happen, but I also want to do it at a responsible pace that can be managed and sustained.
Aya?
Hi, Chief Gillespie. Building off of that last question, I think you know, I don't want us to have to get stuck in a zero-sum game. I understand how we have to deal with the tough decisions at any given moment, or you do, but I would like for us to be able to cast our imagination around where we want to go. And where I'd like to go is to have our fire bureau fully funded so that you're not having to make these decisions, and Portland Street Response fully funded. So, but in order to do that, we need transparency around what that looks like. So my question for you is, and if we can't do this tonight, I just like to get there. What is that? How much is that? What do we need to be advocating for Portland Street Response, for the Fire Bureau, right? Because all of us as residents of the city, we can get on it. We can fight. We don't want to just be talking about what we can't do. We want to actually be all gathering around the Portland that we want to see. So what do you think that looks like? What's the number to fully fund Portland Street Response at 24/7?
Yeah, great to see you, Kaya. Great question. I don't know the number. I don't know the complete number. It's really difficult to judge because costs are going up so rapidly, right? We look at equipment purchases, vehicle purchases, labor agreements, and PSR employees are represented by two different labor unions. The costs of running a program are going up rapidly. So I would be guessing if I gave you a number. We have some great budget people in the city that can forecast that. What I will tell you is that very likely we are going, and unfortunately it is a zero-sum game when it comes to budgeting for the city, because we will be allocated a certain amount of money to fund our program. So we may get $100 to fund $120 worth of programs. We have to figure out where that $20, what we don't buy, what gets cut off of that. Could we go find that $20 somewhere else and then add that into the pie and be able to fund the programs fully? Absolutely. And I think that's where, and the work that Friends of Portland Street Response has done to advocate for this program has been incredible. And like, I forget who mentioned it before, but 10,000 signatures were found in short order and delivered to City Hall. I really think for Portland Street Response to have sustainable funding, it has to come from places other than the city. So while advocating for budget, for funding for Portland Street Response from the city, I get it, absolutely important. And this is just, again, I don't have a number for you, but I don't think there's enough money to fund all the programs that need to be funded within the city. And again, because there's an opportunity for the program for Portland Street Response to serve folks outside of the city limits. Let's look at funding out there as well. So,
Chief, and just as a follow-up quickly, who can give us that number?
Well, I would just suggest you follow along on the budget process, because all that happens on the back end, right? So as budget documents are submitted, programs are costed out, allocations are given, and so you're able to see kind of where the money goes and how it's being spent.
But we need it on the front end, both with the city budget process and elsewhere, right? We just need to know what we need to fight for.
Right. I understand, and I wish I could give you a hard number, but I don't have that.
Ashley.
Thank you so much. I guess I just want to push back a little bit on not knowing that number of what is needed to fully fund PSR. You know, we've been talking about this for years now. We've known it's coming up. One of my specific questions, possibly, Ryan, if this is for you, or perhaps this is for Stephanie in the mayor's office, but what are the updates around the Medicaid, paying the program through Medicaid, which our understanding is if PSR was a 24/7 program, the city could qualify for that funding. That was something that Commissioner Gonzalez's office brought up during our last meeting around this back in August. So, you know, it's a good year And somebody who does budgets for a government entity, we know these numbers far before the process starts. So the two questions here. One is around Medicaid and what's sort of been done into that research. But then two, I mean, there's got to be a number that has been talked about, because I think not knowing that number kind of just feels like there isn't this, I interpret it a little bit as there isn't this intentful focus to support PSR, this program that we've all said works and will benefit the community. So, if we're trying to build a space, we're trying to support it, try to expand it. I would imagine that leaders of the city would have some number, like somebody said it, some dream number even. Like, what's that dream number that would make our city safe or would, and I know, it's budgets are limited. I know there's, I know the constraints, but there's gotta be, if there's not discussion around it and there's none of that, like Kaya said, how do we advocate? If we all support this program, then how are we as a community, as advisory groups, gonna get behind city council who carries the purse? How are we going to ask them to support this program if leaders of the program aren't sort of coming up with that number? Like, it kind of feels like a disinvestment of not knowing that number. So thank you so much. Two kind of questions there.
Sure.
Thank you.
Yeah. So as far as the number, I understand your frustration with that, but there's factors that go into it. So with the $10 million that's budgeted for this year, we could go 24/7, but we might only have one response unit on at a time. Right. So we'd have one PSR unit that is responding to the entire city. So you can't just consider the time frame that it covers, but you have to also measure the strength of your response. Right. In the perfect world, we would have a fire station on every corner, and a PSR unit to go along with them, because then they could respond to anybody in a minute, in 30 seconds. Not realistic, right? We're not going to have a fire station on every corner, and we're not going to have a PSR unit on every corner. Where is that happy medium, and what is the appropriate number of responders? What is the appropriate response time? Is it 5 minutes, 20 minutes, an hour? Those are all, as we continue to gather data on the program and look and see what the outcomes for people, we can determine what that is. We know for the fire department, we know what a national standard response time is. It's 5 minutes and 20 seconds from the time we get the call to when we arrive. We're hovering in the upper 8 minutes. So we're well over a national response. We could fix that by investing tens of millions of dollars into the fire department and bring that response time down. But the city doesn't have the resources to do that. I'm not going to ask to do that. And so that's why I totally get the frustration with, why can't you just give me a number? Because it depends on those other factors to make that determination. More is better. More buys you a better first response service, but at some point there's the trade-offs for where that money is coming from, and what it's not paying for. So I'll let Casey tackle that one too if he wants to, and then I'll just quickly on the Medicaid funding. 24/7 is one piece of that to be accredited, and that's kind of being held up as, if you do this, then this will happen. That is only one piece of being able to bill for Medicaid dollars. Some of it is, and Stephanie actually talked about this, Stephanie Sullivan on her interview, collecting demographic information, and the challenges that go along with that to ensure somebody's eligible for Medicaid and to be able to bill for that. We also, when I talked about not having a planning section, we also don't have program managers. So we've got lots of programs, but we've cut all of our program managers. So what it would take to have a system that we bill for service, whether it's Medicaid, private insurers, anybody, there has to be a program built behind that to support it. And we don't have that right now. So there's more challenges than just, if you go 24/7, you're going to be eligible for this money. There's much more to it that we have not been able to tackle all that yet. Casey, did you have anything to add about the money that would be required?
Yeah, I was just gonna kind of point to some things that we saw during our work, that you know, all three of these functions kind of started in different ways. I think, like the chief mentioned before. So PSR started with Commissioner Hardesty, Care Oregon chipped in for chat, and Community Connect was relatively small and maybe drafting off those programs a little bit. So they had never kind of been brought together as this is like what we're trying to do with this division, and this is how these programs maybe collectively contribute some benefit, and this is our plan for growing these programs. It was find funding from where we can and try to keep it going, and like the chief said, like a lack of planning and administrative support around the sorts of things that you need to say this is what scaling up looks like, and this is what how this should be in the future. I think are some of the things that we bumped into when we were identifying cause of some of the issues. So I think Kip hit on it earlier on, like the goals that you have for community health programs are the things that, in addition to out overwhelming community support, are the things that you can use to sell a program, to grow a program that you are able to kind of show through the budget process, like successes. And that's why our audit reads the way it does. It may seem boring for it to be focused on, you gotta have goals and measure your performance and adjust those based on success, but that's how things succeed in government, particularly newer programs.
I saw a couple chats pop up here, and they pop up and then disappear. Let me clarify the statement about program managers. We do have a PSR, an interim program manager. We do have a chat program manager. What I meant by that is, as we bring on new programs, we don't have extra program managers out there to assign to them. And so the specifically to the Medicaid billing side of it, that would be a whole new program. We don't have a person that has the capacity to be able to take that on. So and that probably sounded weird when you guys all know that we do have program managers for especially these community health programs. So I just wanted to clarify that.
All right, Tim.
Yeah, this is great because my comment follows exactly on what Casey was just saying. I think one thing we haven't exactly said here about the auditor's report that's really fascinating is the thing about goals. And it seems like there's a real disconnect here between what the people want, which is the goal of serving people in emergency situations, particularly this addiction crisis that we're having. And the city everybody wants that and wants to ramp up. But then there also seems to be a goal that's cropped up in the process of relieving the fire and police department and their work, which seems to me to be contrary to the goal of ramping up. That if the goal has to be we're meeting the needs of fewer fire and police, then that becomes a metric that gets weighed against, is this program being successful? When the program being successful should be, are we treating people? Are we getting out there and meeting them on the street? And what I'm hearing from the fire department, from the fire chief, is that they aren't able to quickly. There's a lot of talk about slowing down, not having enough funding, not moving forward. So maybe the fire department isn't the right place to house this if they're not able to ramp up the capacity quickly as the city wants. And this requirement. So I wondered if, Casey, could you address whether you feel like I'm summarizing correctly what the report says, and then maybe Ryan could address that.
Yeah, I think that's a good summary. The point around maybe reducing workload, another way of looking at that could be provide the most appropriate response. You know, these are new ideas. The Citygate folks who are, you know, fire chiefs from around the country and people with a lot of emergency response experience kind of highlighted that these are new and different ways of responding to community health needs. So that's another way of looking at it is, you know, we had, you know, limited tools in the past to respond to situations like this. So it's maybe reducing a workload that fire or police maybe weren't the appropriate thing to deal with in the first place.
Yeah, Tim, I'm not sure what how I can address your question best, other than it was, you know, as I said in my response to the audit, that wasn't the goals of these programs to reduce fire workload. Again, it was a benefit of the chat, and I will say, as I said, our opioid response, overdose response unit that is currently responding and has been now just for a couple weeks. That one absolutely is to reduce the call load of overdose calls. But prior to that, it was a benefit of the program, but not a goal.
And why is that new program started, which it seems like it might be drawing attention away from PSR?
It's very different than PSR. Their goal is very different. So the goal of the overdose response team is to respond to calls that come into dispatch for an individual who's overdosing on the street. And these calls sometimes come in as an overdose. Sometimes they come in as a cardiac arrest, a respiratory arrest. We've narrowed it down specifically to the overdose type code that's dispatched. So that's based off the information that 911 gets and then sends. So instead of sending a 4-person fire apparatus and a 2-person ambulance from AMR in Multnomah County, we're sending chat responders. And we also have a second piece to the program that's going to be coming online. Buprenorphine is a drug that's is a fentanyl blocker, and it's really a pathway to help folks get into treatment. And so this program is through our chat program. We're using chat personnel, and Care Oregon again has funded this through a grant. So we're taking this on without any additional cost to the general fund. Different than PSR. PSR has never responded on overdose calls. They come across overdose calls and they end up on scene where overdoses are happening. And oftentimes the mental and behavioral issues are a crossover with an addiction issue, but they are not dispatched to those types of calls. And PSR has Narcan. They have Narcan that they can hand out and leave with folks, but a different mission than that overdose response team in chat.
All right, Barb.
Hi there. Oops, hold on. Morning, voice. So I'm really excited to hear some of the things that you said and some of the new programs that are coming online. I'm a huge fan of deflection as far as keeping people away from other people with guns and things, basically. And so I've looked at PSR as a deferral program. I look at Project Response, which now doesn't always show up with the police, which is really nice to know. And then there's other stuff that's supposed to be coming online. Unfortunately, we're a state that sucks when it comes to behavioral health. So it's kind of hard to say, yay, rah, this stuff is coming, because I can't really believe it's going to be here until it's here. But there is a whole nother other systems, but it's sort of like a yes and situation. And I heard the answer to what the blockade is with the Medicaid funding. And I'm not hearing that it has anything to do with OHA. And if I could confirm that, that would be great. And if there's a hangup with OHA, I would love to talk to somebody about understanding that. In my day job, not really my day job, I go hang out at a bunch of other advisory councils, including the behavioral health ones for OHA. And anyway, basically my question was about the Medicaid. So I think you answered everything that I had. Thank you.
Thanks, Barb. Yeah, I would like to connect you with Stephanie Sullivan because she can go into
Connect us.
Yeah, as many or as little details as you want about the specifics with the Medicaid funding. So
Because
I'm
we
happy.
were really intentional when we were setting it up
Mhm.
in terms of hiring and stuff, but the bill wasn't finished then, I think.
Yes, and really, I again, my understanding it's not so much OHA, it's really that demographic piece, and that is that's the challenge right now on how can we capture that funding or that money when we don't get the demographic information for the folks, for the clients. So, but yeah, Barb, happy to connect you with Stephanie afterwards.
Okay, I'll put my information in the chat. Is that okay?
Sure. Yes.
Okay.
All right, Andreas.
Thank you. So I guess my questions are really in the vein of like, how are we getting to Portland Street Response being supported and being in a place to be stable long term? So if we rewind to beginning of last year, the program had been fully funded by council. It was on track to expand for 24/7 citywide coverage. And then there was a hiring freeze, and then there was a budget shortfall, and then that never happened, and now we're here. So I think part of my question is what happened? And then I think like as a spin-off from that, I know in the audit report, one of the things they mentioned was that there wasn't a clear plan for these programs. And then today we're hearing that we don't know what the budget number is for the program to be fully funded. So I'm wondering like what the plan is to make a plan, and if this is going to be something that is a top budget priority for fire entering the budget cycle.
Sure. So I think that probably the best answer for you for why things seem to slow down or why they weren't expanding as rapidly as possible, I would refer you to my response to the Portland State study, because that was, of course, a recommendation from them. And so if you haven't had a chance to look at that, take a look at that. And I kind of go through the reasons of why we did what we did and why we were where we were. The budget question, again, it's Portland Street Response. This current budget year is funded at about $10 million. Less than or I'm sorry, over half of that is one-time funding. So my goal, and to be fully funded, the goal would be to maintain the same funding level, or that we would have in the current year. Again, with inflation, with rising costs, that would be the goal. But my goal is also to maintain our same level of emergency operations response across the city. Are we going to be able to do all of it? I don't know. So it may have come across like I've got no idea and I don't even know what I'm asking for. That's not the case. You know, I think the question that I was trying to answer, and maybe I didn't do it very effectively, is what does full funding look like? And that's where we get into the complexities of what's the appropriate number of units on the street. How do we deploy them? Where do we deploy them? And it gets much more complicated than just throwing a number out there.
Yeah, no, that's really helpful. And so if I'm hearing you right, it's that given the one-time funding, the program is starting 5 million in the hole, or it has to find 5 million of one-time funds or other funds to maintain current funding, and it's competing with funding fire. And so that seems to be part of the, like, there is still not a plan to make a plan.
Well, I want to just be clear too that this is the challenge with city budget, right? Is it comes across as a competition between bureaus and between programs. It's I don't look at it that way as a competition, like who's best, who's going to win, what's going to get funded, what isn't going to get funded. Across the entire city, programs and employees that are funded by the general fund are, if you look at it as a competition, everybody's competing for those same dollars, right? And the however you want to put it, the strongest will win, or the most loud will win. And it's I don't look at it that way. I look at it, I mean, within the bureau that I manage, I look at the programs and how we can best allocate that limited money to have the least impact on the community. Across the city, that has to be done at the city council level, and I don't envy their jobs at all, right? It's very challenging to take that limited amount of money and try to allocate it. So I don't, again, you can look at it in different ways, but I try not to look at it as a competition, because when you get into that, you get into value statements and who's more valued, what's more valued. And you just can't do that, right? It's every one of the employees that work for Portland Fire and Rescue, I value them. They all bring something different to the table. We have a very diverse workforce and experience, education, and background. They're all incredible people. I don't value one over the other more, one program over the other more. That's just how I address it.
Okay, Jackie?
Yeah, thank you. Chief Gillespie, my name is Jackie Yerby, and I'm part of Friends of Portland Street Response. And I am so glad to hear you say that you value all Fire Bureau employees equally. And I think about, I think it was in the PSU report, something about the culture that there was a disalignment between the cultures of the Fire Bureau and Portland Street Response that was negatively impacting Portland Street Response. And we're also hearing that that Portland Street Response staff don't have access to resources to give to the people they encounter, that in some cases they may actually be spending their own money to be able to give people water and snacks and other things to de-escalate. Heard things about resources in locked cabinets and employees being accused of stealing. And so to me, that does not sound like value, that they're being valued. And so I'm really curious, one, what you're doing, what you and your leadership team are doing to address that cultural disconnect, and what you're doing to make sure that staff, our Portland Street Response staff, have the resources they need to do their jobs.
Yes, thank you, Jackie. I'm happy you asked the culture question, and that was really one of my main goals for moving the community health programs under medical services and training, was to bridge that gap. What had happened, and I addressed this in my response to Portland State as well, is the community health division was running down its own parallel track, right? It was at breakneck speed, trying to build a program extremely rapidly to meet what the community was asking for. What happened was that there was the crossover between the rest of the Fire Bureau was not happening. They were doing their own thing, for lack of a better word. And that, in my mind, that really led to this cultural difference where one group didn't feel like they were part of the other, or they weren't included, or they weren't valued. my goal of moving the programs under Stephanie and under medical services and training is that they would be even more incorporated into the fire bureau. So that was one step I took to address the culture. We also encourage and support our operations crews working with Portland Street Response and vice versa, and just getting to know each other, right? Just that relationship building piece. As far as the resources and the supplies, this was one of the big challenges that I saw when I was the interim division chief of community health for a short time this spring. Was as they'd been running down that track at breakneck speed, we were not following procurement practices, purchasing practices that are really quite strict within the city of Portland. I think Casey can probably speak to that more than anybody else, because I know they've done audits on bureau before, on other bureaus before. As a city employee, as a city entity, I cannot just go out and buy certain things with a credit card. I'm not allowed to do it. We have contracts in place. That was happening in community health. That things were being purchased without proper approvals. There was no way that the city, we had to take a $160,000 furniture purchase to city council for approval so that we could pay the vendor, because it was purchased outside of city guidelines. And it's not to blame anybody. This was a symptom of a program undergoing rapid expansion without that adequate foundation or oversight, which Casey and his team recognized in the report. And the supplies, the water and the snacks, I don't know that we ever stopped handing out water. That was a pretty easy one. The snacks and the food, we had to figure out who was the vendor, what could we purchase, how could we purchase it within city guidelines. We have those now. We have some clothing items that we can hand out. I think in public service, and as I know many of you work in this world, there's always limited resources, and there's never enough for everybody to hand out. So we operate within those constraints as well in what we can purchase and what we can distribute.
And I just want to say, Chief, thank you for the response. Appreciate what you're trying to do. And I'll say what we're hearing is that is not happening, right? So complete disconnect between what you just said about ability to hand out resources and what's actually happening. And I'm going to trust the people who are front lines.
Abs?
Hi. Thank you. And I know we're running out of time. My pea brain is about ready to explode after trying to assimilate all this information. Thank you, PCCEP members, for all the work you do. Thank you, Chief Gillespie and Casey, sir, for all that you've done. Okay, I'm going to circle back to something that a woman named, I may mispronounce your name, I think it's Kaya, K-A-I-A. She spoke quite a while ago, and her question was, okay, what can we community members do? What can we do to move this forward? I've been in so darn many Zoom meetings, and everyone seems to agree that we need to do this, that we need to focus on community safety, that we need to have everything that everyone said, right? All these efforts need to be coordinated. So in my humble opinion, what I can do as a 75-year-old lifelong Portland resident is I can make damn sure that the city council members in my district, District 2, that I can make sure that I hold their feet to the fire. I'm going to a community meeting on Sunday with all the candidates for my District 2. That's Northeast Portland. And in terms of the transition process and all of that gobbledygook, and it's a process that's kind of a mess right now. However, there is that old saying, where there's a will, there's a way. And in this country, in this state, in this city, when decisions are made about what in the hell the priorities are, the money always seems to be there. And I may be being too optimistic, But if we citizens of Portland and those in leadership positions, including the new city council and the new mayor, want these things to happen, they will. And trust me, I will be following the budget process that starts in April. I probably won't understand most of it, but I at least see it. Thank you again for all of you here, all that you do. And I just believe if we want this to happen for our city, we need to make it happen. Okay, thank you.
All right. Next we'll go to Corinne.
Hi.
Hope I'm saying your name correctly.
You are, Corinne, yes. I'm just, having a question about the boring aspect of funding. We know that behavioral health is allocated to the county duties. And so also public health is allocated to the county duties. And we know that there is a substantial amount of dollars that reside under the county. And we also know that most Portlanders are in favor of PSR, not just to maintain PSR, but to expand PSR and also expand geographically PSR. So we have boundaries, our city boundaries are bound by Portland Fire. Multnomah County is not limited in that regard. And so we could serve underserved areas such as Gresham, further east in the county. Is there a conversation to move PSR to the county funding and really put it where it belongs with behavioral health?
Well, that thought has been out there for some time. I think there's a couple of pieces to it. So there's actually moving the program and who has oversight, who manages it, who's the labor contract with, who does the staffing, who buys the vehicles. So there's that piece, the oversight, and then there's the funding side of it. I truly think that this program, because it crosses so many boundaries, and Corinne, like you said, the behavioral health aspect of it, the public health, which the county has responsibility for a lot of that. This program has to be a partnership. It cannot just be the city of Portland. It cannot just be Portland Fire, who has the not only the management responsibility, but the financial responsibility to keep the program going and keep it growing. So that partnership, in my mind, it's inevitable. What it looks like as far as management versus the financial piece of it, I don't know what that future state looks like. I'm quite certain that we will not be able to keep doing it alone. And that's like many of these complex problems that the city's facing and that we're trying to tackle in different ways. We're not going to be able to go it alone. There was a joint emergency declaration that was just done yesterday between the state, the county, and the city for the fentanyl emergency. And that's to bring resources together to ensure alignment and shared objectives and shared goals. I'm really optimistic about that. I want to commend the mayor and his team for putting that together. And I'm optimistic for that because that's what it takes to solve these really difficult problems. PSR and the difficult problems that the community has, the issues that PSR is responding to, it's the same thing. It's going to take a team. Right now, there's a lot of focus, from my perspective, on what's the city doing, what's the Fire Bureau doing. You need to fix this. You need to find funding. We just can't do it all. We just flat out can't do it all. And so that partnership has to be developed. And that's my goal, is to keep working towards that.
And it seems, just to conclude my thought, that the county funding kind of flies under the radar. And I think for the audience, that's really important to know that there is funding and that we just need to go ask for it where it's at right now so we can expand services right now in an equitable way. Thank you, Chief.
Thank you.
All right, so we're going to take one more comment in this section because we're about 2 minutes in. If there's room still, 2 minutes left for this section. If there's still room, we'll take one more, but just giving a heads up and marking time. And the next session, it will be open public comment. Meg?
Hi, I guess I just also had a funding comment more than a question, and it was kind of piggybacking off of that and where funding is. I think a lot of people are confused about how Medicaid in Oregon works, but just in short, Care Oregon is the organization that has the money from Health Share, which is basically like the local Medicaid money. And there are really very few restrictions on how they can spend their additional resources. They, as far as like people with funding or organizations with funding, they're sitting on about $1 billion in additional revenue that they were they acquired through Medicaid. And just like they did with chat, they can fund PSR if they would like to. And that might be the direction that people want to petition for additional funding.
Thanks, Meg. Yeah, Care Oregon has been a really great partner on the chat program, and that I don't know all of their funding sources and allocations, but I know that the funding for chat came out of their innovation fund to really try this out as a proof of concept. We weren't sure we were going to get a second this last tranche of money from them, and we were able to do that, to keep the program running for another year, but we'll be facing the same scenario coming up. So thanks for that piece there, Meg.
Okay, so we're going to go ahead and move to open public comment at this time. Actually, I definitely see your hand there. So, but at this time, you're open to come off mute or raise your hand again, and then you'll be called on. And your comments your questions can be related to the topic of today or other PCCEP business. Yeah, there's that slide. Yeah. So yeah, we're going to be open for you all to share any other input around PCCEP that you like. Ashley?
Yeah, thanks, Rita. I did want to make sure before we left, Stephanie Howard from the mayor's office, I wanted to ask you sort of a question around this discussion about coordinating groups that impact the success and expansion of these kind of community or these alternative responses programs. And and I had asked you earlier through email, just so maybe if there's an available update to, I think last time we spoke with the mayor's office about this topic last August, we had talked about this working group that would sort of address sort of these coordinations, with like BOEC and PSR and the PPA, just like to be able to coordinate who's taking what calls and maybe even funding, right? Like, actually, I'm not specific if that's what was charged by the work group, but curious where the city is sort of leading the charge in this coordination of partnerships to make sure that, as Chief Calypsy said, it's going to take more than just the Fire and Rescue and Services Bureau to expand this. So wondering if you have any thoughts to share about that.
Yeah, thanks, Ashley. And since your email, I've been able to confirm some information, and I think I can unravel a little bit of what we're talking about. So the group that you're talking about is a group of leaders from the different labor unions that are involved in kind of public safety bureaus and where PSR is living. And those folks are in consistent contact. They've been working together to help develop some of the policies and support Deputy Chief Sullivan and the program manager, Lila, in developing some of those foundational policies that have not existed for PSR until now. So that effort is really focused on operational and the coordination of how do these bureaus work together. I think that work is well underway. And Chief Gillespie can weigh in if he would like to on that. But I think those are really fruitful and positive conversations, and all very focused on setting up strong systems that are sustainable and that will help with having these first response systems work together. So there's that piece. One of the questions that you mentioned earlier, I think, was more about like organizationally, where does PSR live, and some of the questions that we're talking about tonight. And so that's different. That group's not tasked with that specific question. So that question, you know, as we've all heard, is a really complicated question. As I understand it from conversations I've had with Commissioner Gonzalez's team, I think those, you know, conversations have been happening with the county. And I think there are, you know, I think every option is on the table as far as we're all concerned. What do we need to do to make this successful and support this program? So, you know, we've talked a lot about budget and the challenges in different kinds of funding. I mean, we're very early in the budget process. There's a lot of ways, you know, a lot of work to go in developing all of this, and City Council is beginning a bunch of work sessions that you can all tune into on different service areas. And I think Casey put a link to next week's work session on public safety. And these work sessions are meant to inform before, you know, so that council has time to consider the decisions and to figure out how to use the resources in the way that is, you know, best for the city, that's best for the constituency, and trying to figure out how to move all those many complicated pieces. So I encourage you all to join those. But I think, you know, to the point that Chief Gillespie is trying to make, let's, you know, we will happily go out and advocate for support from other funding sources, whether that's the county, whether that's health share. We are open to doing all of that. And as I understand it, you know, with the commissioner in charge, I think their team is working to do that. I know, as Ryan said, we're always looking at how to find new money. We're always doing that. But I would absolutely welcome the support of the community to express that need for a cohesive, you know, and collaborative approach to this program that can serve more than just the city of Portland, if we can get the right, you know, the right structure to it and the right funding behind it. So the county, I think, you know, health share is also another option, as was suggested, but it's an important program to everyone. And I, you know, if nothing else is taken from this meeting, I hope that people can take away that there is a lot of work being done to try to figure out how to make sure this, you know, is a supported and lasting program.
Andreas?
Yeah. Thank you, Stephanie. That was really helpful. And I think just as a follow-up to that, I think like Kaya and others have said, just like telegraphing that of like clearly when things are about Portland Street Response, people show up. And so if it's like, come show up to this county meeting, come show up to this Care Oregon meeting, come, like people will show up if the commissioner in charge or the mayor or like anyone decides to tell the community what is needed to chase funding. And then I think the only other piece to the county component is I think everyone wants to see PSR everywhere. That sounds great. I think where people start to get hesitant is when you talk about decoupling it from the public safety system, right? Like 911 is city, police is city, fire is city. And so to take something away from the city and put it somewhere else or to contract it out, like that would not make it an equal response branch of government. And so I know everything's on the table, but I think that that's like another area where folks will start to get a little concerned about what that would mean and what the implications are for our public safety system and being able to have the right people show up to the right calls.
All right. Are there any other comments or questions from the community here? Art.
I just forgot to say one thing. I put it in the chat, but probably went by too fast. As far as the advisory council to help y'all move forward, I really want to say nothing about us without us. The community started this and the community should be gone back to. And I'm disappointed that PSR never got their stuff together to get their own advisory council, but things happen and there's resources that, you know, that part of it. But I really think reaching out to the community would be helpful.
Any other questions or comments? Oh, actually, was that a hand?
No,
Oh.
it wasn't.
And Casey, I saw you come off mute.
Yeah, I can't figure out how to raise my hand. Sorry. A couple of things that I tried to address in the chat that I wanted to highlight for everybody. We do follow up on implementation of our audit recommendations on an annual basis, and we report that on our website in a kind of annual status report and on a dashboard. We are also restarting our practice of presenting audit reports to City Council. So we're gonna do that on a quarterly basis. Wait till we have like a few to present at one time, and I'll make sure this group knows when that is happening. So it'll be this and 2 of our other audit reports probably. But just to kind of honor what folks have been saying and asking about in the chat, I wanted to share that with everybody.
All right. Thank you, Casey. And can we get the slides really quickly?
For me?
Oh, no, from.
No. Okay.
Yeah. And so thank everyone for their comments and questions. Casey and Ryan, we really appreciate you all showing up today. This is how you stay in touch with PCCEP via email, website, X, Twitter, X, also known as X, and Instagram. So next slide, please. And just a reminder, upcoming dates, next week, February 7th, the Settlement and Policy Subcommittee and Cocoa Town Hall is next week. So please show up if you're able to and engage with another opportunity for good community involvement.
Yeah, and for those unaware, Cocoa Town Hall, those are the events where the PCCEP is able to host presentations where we learn about how the settlement agreement between the city and the DOJ is progressing. So like the remedies under the settlement agreement, what is the progress and what's the compliance and that kind of thing. That's what a Cocoa Town Hall is. So if you've never been to one, consider coming next week. We'd love to see you there. Yeah, with that, we did great on time tonight with so many voices in the space. I'm so grateful again for our guests, Casey and Chief Gillespie this evening, and to all of our PCCEP members and community attendees. Thank you all so much for this very informative discussion. And with that, the time is 8:02 p.m. and this meeting is adjourned.
Thank you, everybody.